is red.
Okay. So today I'm going to be practicing inserting an NG tube. The first thing I'm going to do is I'm going to go walk into my room, and I'm going to pull the curtain, provide privacy. Hello, my name is Joy and I'm your student nurse for today. Would you please state your name and date of birth, please? Alright, Mr. Jones, I'm going to be inserting an NG tube in you today. This is supposed to help with the reflux and the vomiting that you've been having lately. Alright, so now I'm going to verbalize, or first I'm going to raise the bed to a working height. I'm going to raise his head to a high Fowler's position. And then I'm going to lower the side rail. And I would wash my hands at this point, and now I'm going to put on gloves. Alright, Mr. Jones, I'm just going to put this over you, just in case we have anything that spills. This will be an emesis basin for you to use should you need it, should you cough up something or feel like you're going to vomit. And here's your water. In a little bit, I'm going to ask you to swallow, and when that happens, you'll use that. Okay, I'm going to prep all my equipment. I've got my pieces of tape set out, and I will, in a 60 milliliter syringe, pull back 30 milliliters of air. Alright, Mr. Jones, before I get started, I want to assess the inside of your nose, see which side we're going to use. Alright, everything looks good. I'm then going to attach my syringe to the end of my tubing. Now, Mr. Jones, what I'm going to do next is I'm going to measure so we know exactly how far we need to insert this. From your ear to your nose, and then from your nose to point on your chest, your xiphoid process, and I'm going to mark this with tape. Alright, Mr. Jones, if you're okay, we're going to continue on. What I'm going to do now is I'm going to lubricate the end of my tubing. Alright, Mr. Jones, we're going to set your head back just a little bit, okay? Alright, I'm going to insert this into your right nostril, okay? Alright, now that I've gotten it to the back of your throat, I'm going to need you to put your head forward, and then whenever I tell you to swallow, I want you to take a sip of water, and I'm going to push it in farther. Swallow. Swallow, swallow, swallow. Okay. Since we're using a dummy today, I'm not going to be able to insert the tube entirely. If this was a real person, I would then, if I had any resistance and didn't reach my mark, I would then remove the tube and reinsert, well, remeasure and then reinsert. Now I'm going to tape this to the side of their cheek. And I'm going to verify placement. Alright, Mr. Jones, I'm going to look at the back of your throat and make sure the tube hasn't coiled at all. Okay, and it looks straight. Can you please state your name for me? Alright, that sounds good. Alright, so what I'm going to do now is I'm going to tape it to your nose. Oh, first, I'm going to aspirate some gastric fluid. clamp it. Alright. The normal acidity for gastric content would be 1 to 4. Mr. Jones's today is a 3. So that's within normal limits, and so he is fine. Alright, and now I will tape this to his nose. Alright, Mr. Jones, this is just to secure it so that it doesn't go anywhere. Alright, and what we're going to need to now is I'm going to tape this to your gown so it doesn't pull at all. And we're prepping you for x-ray. Move all of this out of your way. Does everything feel all right? Are you feeling okay? All right. I'm going to lower the head of your bed to 30 degrees. I'm going to pull up the side rail and lower the bed to the lowest position. And here is your call light, making sure that it's within reach. Now remove my gloves. And wash my hands. Alright, Mr. Jones, I'm going to let them go ahead and take you down to x-ray. If you need anything, you call me, and here's your call light. And now I would remove privacy. I've made sure all of my equipment is out of the room and cleaned up. And now I would go document. I would document the side of the nose in which I inserted the NG tube, the size of the tube in the NG tube, the number of attempts that I made, the pH of the gastric content, the color and consistency of the gastric content, and the x-ray, making sure that it was verified. Then the next thing that I would document would be that I would document the whether it was clamped, attached to suction, or if it was attached to a feeding bag. And then that's it with my insertion of my NG tube. And now my next step is removal of the NG tube. I would come into my room, I would introduce myself to my patient. Hi, Mr. Jones, I'm here to remove your NG tube today. I've given privacy. I'm going to raise the bed to a working height. Can you state your name and date of birth for me, please? And I've verified my patient. I raise up the head of my bed. And I have washed my hands. And, first I'm going to lower my side curtain. Okay, now that I have my gloves on, here's a linen protector to protect your sheets and your clothing. I'm going to untape this from your gown. Alright, Mr. Jones. tape this from your nose. Now, I'm going to pull this out in swift motion. I want you to hold your breath when I do so, all right? 3, 2, 1, deep breath. Very good. All right, I'm going to dispose of this in my biohazard container. All right, Mr. Jones, I would give him a tissue at this point and a wet washcloth, help him clean up his face, make sure that everything's okay. Is there anything I can get you today? Is everything all right? If the patient's fine, then I would raise my side rail. Not drop my call light. Put my call light within reach. Then I would lower the bed. Okay, and after this I would remove my gloves, wash my hands, and then I would go to document. And for this, what I would document would be, once again, the size of the NG tube that we inserted, how the patient tolerated the procedure, and making sure that all the safety protocols were put into place. And that is the end of my video. Yes. Okay.